Welcome to this episode, where we're diving into a critical and complex issue, how digital divides impact education around chronic kidney disease, or CKD. It's a topic that's both timely and deeply important, given the rising prevalence of CKD worldwide and the growing role of digital health technologies.
Yeah, absolutely. CKD is such a multifaceted public health challenge, with causes like diabetes, hypertension, and glomerulonephritis all playing a role. And while patient education is key to early detection and management, there's this huge barrier we need to talk about, what the document calls digital deserts, areas where technological infrastructure and internet access are just, well, basically non-existent.
Right, these digital deserts create a kind of information wasteland, especially for rural and socio-economically disadvantaged populations. It's ironic, isn't it? We have all these advanced digital health platforms revolutionizing patient education, but large swaths of the population can't access them. So the benefits of early CKD detection and management aren't reaching those who might need them most.
Exactly, and that exacerbates existing health disparities. It's not just about technology availability, but also about who can actually use these tools effectively. Which brings us to the importance of integrating diversity, equity, and inclusion, DEI, into CKD education strategies.
Yeah, DEI is fundamental here. Socioeconomic status and geography heavily influence access to digital health technologies. People in rural or low-income communities often face significant barriers, not just in infrastructure but also affordability. Early CKD detection and ongoing monitoring rely on these digital tools, so the divide becomes a critical public health concern.
And it's not just about access. There are educational and cultural barriers, too. Digital literacy gaps are especially pronounced among older adults and those in lower socioeconomic brackets. Plus, if educational content isn't culturally or linguistically tailored, it won't resonate or engage effectively.
That's a good point. So, targeted initiatives are needed. Expanding digital infrastructure in underserved areas, subsidy programs to make devices and internet more affordable, and policies that ensure equitable access. But also, content has to be designed with cultural sensitivity and inclusivity in mind. Otherwise, we risk perpetuating the same disparities.
And community engagement is crucial in this. Policies alone won't cut it. Involving communities in designing and implementing CKD education programs ensures that the materials and delivery methods actually meet their needs and preferences.
So it's a holistic approach, addressing infrastructure, literacy, culture, and policy simultaneously. Without that, the digital divide will just keep widening.
Speaking of bridging that divide, the document highlights some fascinating technological innovations, like augmented reality, or AR, as a tool for CKD education in these digital deserts.
Yeah, AR is really promising. It overlays digital information onto the physical world, creating immersive, interactive learning experiences. Imagine being able to visualize the complex renal physiology and CKD pathophysiology in 3 dimensions. That's a game changer compared to traditional lectures or pamphlets.
Definitely. And it's not just passive visualization. AR allows users to interact with virtual kidney models, simulate treatment effects, and explore lifestyle modifications. That kind of hands-on engagement can deepen understanding and empower patients to make informed decisions.
Plus, AR can be deployed via smartphones and tablets, which are increasingly common even in low-resource settings. So it has the potential to democratize CKD education across geographic and socioeconomic barriers.
Though, it's not without challenges. Developing high-quality AR content requires significant investment and technical expertise. And ensuring the apps are user-friendly for people with varying digital literacy levels is a big hurdle.
Right, scalability is a concern. It's not just about creating the technology, but making sure it's accessible and effective for diverse populations. That means collaboration between healthcare providers, technologists, and educators is essential.
And we can't forget ethical considerations, equitable access, privacy protections, and ensuring the accuracy of educational content. AR's immersive nature is powerful, but it has to be responsibly deployed.
Absolutely. Now, moving to another frontier. The synthesis of quantum computing and artificial intelligence for predictive analytics in CKD awareness. This is where things get really futuristic.
Yeah, the combination of quantum computing's massive processing power with AI's pattern recognition capabilities could revolutionize how we predict CKD progression and identify at-risk populations.
Quantum computing can analyze vast, complex datasets at speeds classical computers can't match, enabling predictive models with unprecedented accuracy. That means educational interventions can be more timely and precisely targeted.
And AI can personalize education platforms, tailoring content to an individual's medical history, risk factors, and learning preferences. So CKD awareness becomes not just generalized, but exquisitely customized.
The integration of genomic data is another exciting aspect. By analyzing genetic predispositions, these technologies can inform highly individualized prevention strategies, diet, lifestyle, monitoring that embody the promise of personalized medicine.
But, as with AR, there are barriers. The complexity and cost of quantum and AI technologies are significant, and infrastructure needs are high. Plus, ensuring equitable access, especially in digital deserts, is a major challenge.
That's where global collaboration comes in. Health organizations, governments, and private sectors working together to bridge these gaps.
And ethical and privacy concerns are front and center. Using personal and genetic data requires robust protections to maintain trust and safeguard individual rights.
So while quantum computing and AI offer a glimpse into a future of predictive, personalized CKD education, responsible deployment is absolutely essential.
Which brings us to the critical role of community activism and advocacy. Technology alone can't solve these disparities.
Exactly. Community activists and healthcare advocates are on the front lines, mobilizing resources, influencing policy, and ensuring digital health tools meet real community needs.
They can foster partnerships among tech firms, healthcare providers, and policymakers to develop accessible, user-friendly platforms. And importantly, advocate for culturally sensitive, multilingual educational materials that resonate with diverse populations.
Digital literacy promotion is another cornerstone. Community-led workshops, tutorials, and campaigns empower individuals to actively manage their health using digital tools, transforming them from passive recipients to engaged participants.
And integrating CKD education into broader public health and social justice initiatives helps address social determinants of health, amplifying advocacy impact.
So this holistic, inclusive approach is vital to transforming digital health education from a privilege into a right accessible to all.
To wrap up, the challenge of digital deserts in CKD education is multifaceted. It demands dismantling barriers through infrastructure development, DEI integration, innovative technologies like AR and quantum AI, and robust community engagement.
CKD disproportionately affects marginalized communities, and the digital divide magnifies these inequities. Bridging this gap requires collaboration across technologists, healthcare providers, policymakers, and activists.
The future lies in combining cutting-edge tech with culturally tailored content and strong advocacy. By championing diversity, equity, and inclusion, we can transform the digital landscape from one of disparity to one of opportunity and empowerment.
And with collective resolve and innovation, equitable CKD education and management can become a reality for all, regardless of geography or socio-economic status.
Thanks for joining us in this deep dive. It's a complex issue, but one that's absolutely worth the effort.
Definitely. Until next time.